Hello, my name is Bryoni, and I just need to check your vitals, your basic observations. Is that okay? Just need to make sure that you're all clinically stable. Alright, perfect. Well, what I'm going to do first, I'm just going to check your breathing. Okay? So if you can, take a nice deep breath in for me. And out. Excellent. Take a nice deep breath in. And out. Okay, I'm now going to have a little listen. Okay. Just of your chest. It's going to pop this one here. Okay. And this one here. Alright, just take a nice deep breath in for me. And out. Take a nice deep breath in. And out. Okay, I'm gonna pop this here. Okay, deep breath in. And out. Excellent. Your breathing is fine. Okay, I'm just going to check your pulse manually. So I just need to have your wrist here. Yeah, pass me your arm. I'm just going to feel for your pulse. There it is. You have a very strong pulse, which is good. I'm going to check for a minute. Okay? Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, Okay, so your pulse is 76. Okay, now just going to check your temperature. Perfect, so your temperature is 36.5. So your temperature is actually perfect. I'd expect it to be between 36.2 and 37.3. Okay. Next, I'm just going to check your oxygen saturation levels. Okay. So you need to pop your finger in here, just like this. Okay. So pop your finger in there. Perfect. Now we're just going to wait for a few moments. It can take some time to settle. Just take a deep breath in for me. Good. Okay, so your oxygen saturation levels is 100%. Wow. So that's very good. Your oxygen saturation level should be between 96% to 100%. Now it's actually given me your pulse on here. It's saying it's 74. So that's actually really good. It's in line with the manual one that I did as well. So that's great. Everything's looking pretty good at the moment. So I'm now just going to check your respiratory rate, okay? Now this is how many times you take a deep breath in and out naturally, okay? So I'm going to check this now, so just breathe normally. Okay, so your respiratory rate is about 17, so that's good. Okay, I'd be happy for anything between 15 to 20. Okay, for you? Alright, now finally I just need to check your blood pressure. Okay, so I do actually have a automatic blood pressure machine here that I'm going to use on you. Okay, so what I need you to do, I need you to pop your arm in here. Okay, so slide your arm up, slide it, keep sliding, push it all the way up. Perfect, keep pushing, pushing, pushing. Well done. Okay, I'm just going to tighten that. Good. Okay, does that feel tight on your arm? It does? Excellent. Okay, so before I begin, it's really important that your arm is kept down by your side, that you don't move it at all, okay? Don't do a fist, don't wiggle your fingers, okay? Just have your hand nice and straight and flat out, alright? So, I'm just going to start this. Perfect. So that's now inflating. Just keep your arm nice and relaxed for me there. And now it is going to go very tight, okay? Just wait a few seconds and it will start to deflate, okay? So a normal blood pressure is 120 systolic over 80 diastolic, okay? So it's okay, you probably won't reach that. I expect you to have a low blood pressure. Okay, your blood pressure is reasonable. It's 103 over 70. So that's 103 systolic over 70 diastolic. So that's okay actually. Now you can try your best to get it up a little bit. You can have some more fluids, okay? But that's okay. We are monitoring your blood pressure anyway. It says that your pulse is 85. Now this just checks it sort of on a short scale between the few seconds it's checking your blood pressure, so it's not always accurate. That is why I do a manual one as well. Okay, so let's take this one off of you. Alright, just gonna pop that down. So we've actually checked everything we need to. Alright, let's put this over here. So your blood pressure was 103 over 70. Your pulse was, your oxygen saturation levels was 100%. Your breathing was fine. Your respiratory rate was 17. And your temperature was actually perfect, wasn't it? 36.5. Wonderful. Alright. Well, that's all I need to check today. I just needed to check your observations just so we know where you're at. Okay? But that is everything I'll be checking. Okay? How do you feel? You feel okay? Good. Well, I suggest you have something to eat, something nutritional. Have plenty of fluids today, clear fluids please, just to bring your blood pressure up, okay? But other than that, you are absolutely fine, okay? Perfect. Alright, well, take care. Bye-bye. Oh, hello there. Please come on in and make yourself comfortable. My name is Bryoni. How can I help you today? Okay. Well, you've come to the right place. So, have you been experiencing any symptoms like shortness of breath, any chest pain, any palpitations? How about dizziness? Alright, do you suffer from migraines? Okay. And how do you feel when you're sitting down for a long time and then you stand up quickly? Do you ever feel dizzy, lightheaded, wobbly? How do you feel usually? Okay. Alright. Well, it could be cardiac related, so what I'm going to do, I'm just going to check a couple of things just to see how you are. Alright? Wonderful. So, to begin with, just take a nice deep breath in for me. Good. Out. Very good. Take a nice deep breath in. Out. Wonderful. I'm just observing you while you do that. If you can do it again for me, so a nice deep breath in. Out. Perfect. Alright. Well, now I would like you to do that, but hold it. Okay? So take a nice deep breath in. Hold. Let it out. Perfect. How did that make you feel? How does your chest feel? Okay. And how does your head feel? Alright. Could you now just take a nice deep breath in for me? Hold. And let it out. Wonderful. Okay. I'm just going to have a little listen of your chest. Okay. I've got my stethoscope here. Okay. I'm just going to pop this one on you. Just that. Just breathe normally for me, please. Okay. Still breathe normally. Good. I'm just going to pop this around your back, okay? Okay, good. Well, generally sounds okay, alright. Now I am going to get you to do a couple of things while I have a listen. Okay, wonderful. So, just breathe normally for me. Okay. Keep breathing normally. Okay, now take a nice deep breath in. And out. Good, okay. Take a nice deep breath in. And out. Perfect. Okay. Now I would like you to hold it for a little bit, okay? So, take a nice deep breath in. Hold. And out. Wonderful. And we're going to do that again. Take a nice deep breath in. Hold. And out. Very good. Please just breathe normally for me. Okay. Alright. Could you now just sort of pant like a dog, a bit like like that. Ready? Pant like a dog. Okay, stop. And breathe normally. Okay. Keep breathing normally. Okay, pant like a dog. Very good, you can stop. Alright, could you just do a cough for me? Just a little one. Just want to clear Wonderful. And just breathe normally. Okay. All of that sounds absolutely fine. I'm not concerned at all regarding your breathing. Everything appears to be quite clear and you responded really well. What I am going to do, I'm just going to have a feel of your chest, okay? Just tell me if you have any pain or discomfort, alright? Any pain or discomfort? Okay. Now I'm just going to touch your tummy. I'm just going to push a little bit of pressure on that. Okay. Any pain or discomfort? Alright. Just do another cough for me. Okay. Now pant like a dog. I just want to see what your body does. Wonderful. Thank you. Okay. So, I'm just going to check your temperature. This could be a factor for headaches, and you might just be quite hot, so I just want to check that you haven't got a temperature, okay? Perfect. Your temperature is 36.2, so that's okay. You're actually on the colder side. That's alright. Now I'm just going to check your oxygen saturation levels, alright? So I have this oximeter, and I'd like you to pop your finger in there, and it's going to tell me your oxygen saturation levels, okay? So pop your finger in. Perfect. Now yours should be between 96% to 100%. Just take a nice deep breath in for me. Good. You can take some time to register. Wonderful, it's 99%. Perfect. Now it actually says your heart rate is 86. I am going to check your pulse, if that's okay. I just want to make sure it's correct. So I just need your wrist. Is that okay? Perfect. I'm just going to have a little feel. Make sure I can feel your pulse. Oh, perfect. You've got a very strong pulse. 1, 2, 3, 4, 5, I got 83, so that's absolutely fine. I expect them to be slightly different, but I've checked you and your pulse is very good. So next I am going to check your blood pressure, if that's okay. Perfect. So I am going to check it manually, alright. So I need you to pop your arm in here, and I have this little gauge here, and I will be pumping it up. Okay. So if at any point you find it too tight for any reason, please let me know. Okay. So what I need you to do, I need you just to slide your arm in here. Very good. That's it. Pop your arm in. Wonderful. Is that secure? Lovely. Okay. just going to clip this gauge on, just so I can read it while it's on your arm. Perfect, that's great. And just relax your arm down, okay? Just down by your side. Wonderful. Okay, so what I'm going to do, I'm just going to pop this in my ears. So, first of all, I'm just going to feel your pulse, okay? Okay, so I've got your pulse. I'm just going to pump this up, okay? I just need to get a rough idea how much I need to pump it up. Okay, ready? Okay. Alright. Okay. I'm just going to loosen that. Wonderful. Okay. I'm now going to use my stethoscope. I'm just going to place that there, just under the cuff slightly. That's it, right by your main artery. Perfect. Okay, so I'm just going to pump it back up. You're doing really well. Now I need to listen carefully, okay? Okay, I'm just going to slowly release. Okay. Perfect. Well, you have the perfect blood pressure, 120/80. So that's absolutely fine. Alright. Well, I've checked everything today that I want to check. Everything generally seems okay. What I would say is just keep an eye on your headaches and migraines. It is very warm at the moment, and you might perhaps need to drink a little bit more. Keep yourself hydrated, okay? Now, if you do develop any sort of cardiac symptoms, palpitations, dizziness, chest pain, shortness of breath, that kind of thing, please do come back to see me. Alright? Wonderful. Well, take care. Bye-bye. Oh, hello there. Please come on in and make yourself comfortable. My name is Bryoni. How may I help you today? Right. Okay. Now, have you been experiencing any symptoms of any kind? Okay, any shortness of breath? Any minor chest pain? Difficulty breathing? Any palpitations? Okay. How about any sort of breathing difficulties? Okay. Any issues regarding your eyes, blood vision, double vision, any watering, discharge from the eyes, any redness? Okay. Any swollen areas? Okay. Any pain or discomfort anywhere else? Around your ears, your jaw? Okay. And how about any changes regarding your sense of smell or taste? Okay. Is there anything you think I should know about? Okay. Alright. Well, I'm just going to put some gloves on and I will just do a examination of you. Okay. I will do quite a thorough check. I will check your breathing. Okay. I'm going to check your temperature as well. I want to make sure you don't have a fever. Okay. I will also check your facial nerve. I'll have a feel around of your body. And then I will just do some general observations on you. Okay. I want to make sure that you're well. I'm pleased to hear that you're not getting any sort of severe symptoms. That's great to hear. This is more of a general checkup. Yeah. Okay. So, to begin with, I am going to check your breathing. Okay. So, what I would like you to do is just take a nice deep breath in for me. And out. Take a nice deep breath in. And out. Wonderful. Okay. Take a nice deep breath in. And out. Perfect. Okay. I'm just going to have a little listen of your chest. Just breathe normally for me. Okay. I'm just gonna pop this on your chest, okay? That's fine there. Please breathe normally. Good. Okay. Sounds clear. I'm just going to check your back, okay? Just going to come round. Okay. Alright. Everything sounds clear. You don't sound congested or anything. I'm now going to have another listen and I will get you to take some deep breaths in, okay? Okay, take a nice deep breath in. And out. Wonderful. Take a nice deep breath in. And out. Good. Okay, I'm just going to move this. Okay, take a nice deep breath in. Out. Very good. Can you now just do a cough for me? Okay. That all sounds fine. I'm not concerned at all. Okay. What I am going to do, I'm just going to have a little feel of your chest. Okay. Do tell me if you have any pain or discomfort. Just going to touch your tummy. Okay, now just do another cough for me. Okay. Alright. Do you have any pain or discomfort regarding your chest? Okay. Well, just breathe normally. You've done really well up to this point. Okay. Alright. I'm just going to check your oxygen saturation levels. So what I'd like you to do is just pop your finger in here for me. I just want to make sure everything's how it should be. Now it does take a few moments to pick it up. In the meantime, just take a couple of nice deep breaths for me. So a deep breath in, and out. Good, take another nice deep breath in, and out. Perfect. Your oxygen saturation is 98%, so it's absolutely fine. Your heart rate does say 86. This is done automatically on here, but I will check it manually, of course. So if I could just have your wrist, I'm just going to check your pulse. See if I can get it. Hopefully you've got a strong pulse. There it is. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, Okay, I was 75 doing it manually. That's absolutely fine. Both of them were in sort of a good range, so I'm happy with that. Okay, wonderful. I'm now just going to check your temperature. So this is just going to go on your forehead. Okay. Yes. And do you want me to show you on me? Sure. So I'm just going to do this. So I'm 36.3. Okay. I'm just going to do it on you. Yours is 36.7, so you're absolutely fine. Alright, what I'm going to do now, I'm going to check your facial nerve, okay? Now I am going to feel around of your face, alright? And I will get you just to do a few movements, sort of back to me, okay? Wonderful. Alright, so I'm just going to have a little feel. Please do let me know if you have any pain or discomfort at any point. Just touching around to make sure you've not got any lumps or bumps, and that I'm happy with your general facial movement. Generally fine. Just gonna have a feel around here, okay? And on your shoulders. And I'm just gonna feel your arm, okay? Any pain, please do let me know. Good, and the other side. Okay, alright. So, what I would like you to do now is just do a big smile for me. Raise your eyebrows and your face. Good, now do a frown. Good, so smile and frown. Smile and frown. And smile and frown. Okay, can you wink and wink? Very good. Can you now just turn your head from side to the middle, side to the middle? Good, and up and down, and up and down. Wonderful. Just move your head for me freely. Wonderful. Okay, do a smile, frown, wink. Perfect. Now just blink your eyes. Blink. Blink. Very good. Okay, can you do this? And this? Okay, can you do this? Perfect. Can you clap? Good. Can you do this? Can you do this? Can you do this? You can touch my finger. Perfect. Just clap for me again. Do this for me again. Okay. Touch your nose. Touch your cheek. Touch your eyebrow. Touch your nose. Touch your mouth. Touch your cheek. Touch your ear. Touch your eyebrow. Touch your neck. Okay, I'm generally happy with that. What I'm going to do now, I'm just going to check your eyes. Okay, first of all, I want you just to look here. 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 Okay, now look here. 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 Very good. Tell me when you can see my fingers. Good. 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 Wonderful. Now tell me when you can't see them, okay? Good. 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 Perfect. Now I want you to tell me whether I'm close or far. Okay? Was that close or far? Good. 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 Very good, well done. Okay, look straight at my nose. Now, I want you to tell me which side wriggles, okay? You ready? So look straight at me. Which side? Good. 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 Very good. Perfect. Okay, look at my nose. Alright, look at my finger. Just follow my finger. Keep following my finger. Good. Okay, look at this finger. Now follow my finger. Good. How many fingers do you see? How many? How many fingers? How many? How many? How many? How many fingers? How many? How many? How many? Very good. I'm now going to use this cotton bud and I'm going to just draw some numbers out of on my glove. Just tell me what they are, okay? So, what number is this? 1, good. Good. 5, good. Good. 8, good. 9, very good. Okay, I'm now going to do some capital letters. Alright. B, good. D, O, N, good. Z, very good. Okay. I'm now going to have a little look into your eye. I'm just going to grab my light. Okay, I want you to look over here. Do not look at the light, okay? Look over here. Do not look at the light. Okay, now look over here. Okay. Do not look at the light. Look over here. Okay. I'm just gonna look closer. Okay, they're reacting good. This side. Okay, could you just look up for me with your eyes only like this? Okay, look down. Look left. And look right. Okay, look up. Look down. Look left. Look right. Okay, just look at the light for me. Look here. Look at the light. 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 Very good. Could you now just follow the light? Follow the light for me, please. Very good. Keep following the light. Okay, I'm going to use a brighter light. Just look at the light. Look at the light. Look at the light. the light. Look at the light. Okay, just follow the light. Keep following the light for me, please. Wonderful. You can blink now if you need to. That can cause a bit of strain onto your eyes. How do your eyes feel? That's completely normal. I've just used a lot of lights in your face, but as long as there's no pain or anything. Good. Alright, I'm now just going to have a little look into your nose. Okay, just lift your head slightly. Okay, just do this with your nostrils. Okay, and again for me. Good. Okay, what I would like you to do, I would like you to smell this and tell me what it is you can smell. Okay. What do you smell? Well done, that's excellent, you got that right. Okay, I'm now going to have a little look into your mouth. So please just open wide. Okay, your mouth is moist, a tiny bit red, but that's normal. Could you just go for me and open wide? Okay. And just stick your tongue out. Okay. Lift your tongue up and down and side to side. Perfect. What I would like you to do, I'm going to pop a couple of drops onto your tongue. Tell me what this tastes like, okay? Stick your tongue out. Drop. Drop. And what does that taste like to you? What does that taste like? Perfect. Well done. You got that right. Okay, next I'm just going to have a little look into your ears. Okay, and we'll be done. I'm just going to have a little feel first of all. Any pain or discomfort? Okay, now I am just going to do this. Tell me which side you can hear it, okay? Good. 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 Perfect. Well done. Okay, I'm just going to get my little tool. I'm just going to have a little look into your ears, okay? Okay. There's a tiny bit of build up in that ear, but nothing I'm too concerned about. Can I have a little look in this ear? Again, a tiny little bit of build up, nothing too bad. Okay, you've got a tiny bit of build up in both ears, but I'm not too concerned at all. Just pop some little drops in and that'll clear that right up. I am just going to whisper into each ear. Just repeat back to me what I say. Okay. 1, 5, 10, 12. What did I say? Okay. Books. Hot box. Good. Finger, nose, thumb. Very good. Orange, apple, banana. Well done. Well, that is everything that I'm going to be testing on you today. You've responded extremely well. I'm not concerned at all. You have no symptoms. Are you pain-free still? You are. Wonderful. Well, you've had a very successful checkup. I hope you're still feeling okay. But I just wanted to give you the reassurance that everything is fine. You have absolutely nothing to worry about. Okay. Obviously, if your symptoms worsen or new symptoms arise, please do come back to see me. Okay. But you're absolutely fine for now. Alright. Wonderful. Well, take care. And I'm always here if you need me. Alright. Bye-bye. Oh, hello there. Please come on in and make yourself comfortable. As comfortable as you can. My name is Bryoni, and I'm going to be doing your eye exam today. Okay? Now, have you been experiencing anything unusual? Okay. Any symptoms of any kind? Right. Okay. Have you been experiencing any watering from the eye? Any discharge from your eye? Any colour? Okay. How about redness in your eye, around the eye? Okay. And any changes with your vision that you're aware of? Any sort of double vision, blurred vision? Okay. Alright. Well, it doesn't look like you have anything wrong with your eyes, and you've not been experiencing any sort of severe symptoms or anything. Perhaps they're a little bit strained or you're tired, but I will do an examination just to be sure. Alright? Perfect. Is it okay if I just come a little bit closer? I just want to have a feel around of your eyes. Okay? Wonderful. You can let me know if you have any pain or discomfort at any point. Any pain or discomfort? Okay. I feel okay. Could you just do a blink for me? Blink. Blink. Okay. Just give a little feel around. Just close your eyes. Close your eyes. Close your eyes. Okay. Any pain or discomfort now? Okay, alright, you can just blink your eyes. Now your eyes do look a little bit red. Okay, a little bit dry. I'm not concerned, but to carry out this test, I think it would be wise just to pop some eye drops in, just because I'm going to be doing a lot of tests on you, and I don't want your eyes to dry out or to cause you any discomfort, okay? Other than that, it's not going to be painful, these tests, okay? Alright, so I'm just going to grab some eye drops. So, here they are. So that's it, keep your eyes open. Alright, I'm just going to drop. And one more. Drop. Now just blink. Good. Okay. Good. Let's grab some more. Okay, this side. Ready? Drop. Drop. Perfect. Just give your eyes a blink for me. They might feel a little bit wet, but that's okay. Alright, so what I'm going to do, just going to do a few tests with my hands, okay? I just want to check for any double vision, blurred vision, that kind of thing, okay? So what I'd like you to do is just look here, look here, look here, look here, and look here. Perfect. Look at my finger. 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 Very good. And now look straight at me. Look straight at my nose. Very good. Look straight at my eye. Look at my mouth. Look at my ear. Look at my eyebrow. Okay. Look at my hand. Look at my hand. Look at my hand. Okay. Look at my hair. Look at my nose. Look at my mouth. Look at my eye. Look at my ear. Very good. How many fingers do you see? How many fingers? 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 Perfect. Okay. Now look at my finger. Now follow my finger. Good. Keep following my finger. Perfect. Okay, look at this finger. Now follow my finger. Good. Perfect. Okay. Tell me if my hands are close or far away. Okay? Close. Good. 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 Very good. Okay, tell me when you can see my fingers. Good. 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 Wonderful. Tell me when you can't see them. Good. 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 Okay. Look here. Look here. Look here. Look here. Okay, look at my finger. 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 Okay. Look at my nose. Look at my eye. Look at my mouth. Look at my ear. Okay, how many fingers do you see? How many? How many? How many fingers? How many? How many? Okay, is this close or far? Close or far? Close or far? Close or far? Very good. Okay, what I'm going to do now, I'm going to show you some coloured pens and I would like you to tell me what colours they are. Alright? What colour is this pen? Very good. What colour is this pen? Perfect. What colour is this pen? Good. What colour is this pen? Good. What colour is this pen? Good. And what colour is this one? Perfect. Okay, I'm going to show you them a bit faster and I'd like you to tell me what the colour is. Okay, so what colour is this one? Good. What colour is this one? Good. What colour is this? Good. What colour is this? Good. What colour is this one? Good. And what colour is this one? Perfect. Well done. Okay, you can now just blink your eyes if you need to, if they're hurting a little bit. They're okay? Wonderful. So I'm now just going to use this cotton bud or Q-tip and I want you to tell me what I trace on my hand, okay? So this is a number, okay? What number is this? 1. Good. Ready? 2. Good. 5. 8. 9. Good. 0. Good. I'm going to try this side. 1. Good. 5. 3. 7. 1. 0. 8. Very good. I'm now going to do some capital letters, okay? That's A, S, M, R. Very good. Shall I do some more? Okay. This one. Z, N, and T. Well done. You're very good at that. Okay. What I would like you to do now is just look at the orange pen. Okay. Now, only follow the orange pen. Okay. That's it. Just the orange pen only. Just follow the orange pen. Orange pen only. Very good. Okay, now follow the pink pen for me. Follow the pink pen, okay? Very good. Wonderful. Well done. Okay, what I'm going to do, I'm just going to use my book for colour blindness. Okay, so I want you to tell me what you can see. So what can you see inside this circle? What number do you see here? 12. Good. What do you see in this one? Good. How about this one? What do you see? Good. This one? What number do you see? 5. Good. What number do you see here? Good. What number do you see here? 2. Very good. What can you see here? These are getting a little bit more trickier now. Okay. How about this one? Okay. What about this one? Okay. Let's do a few more. What do you see in here? This one is designed to be difficult. Okay. How about this one? Good. Let's do 2 more. What about this one? It's 35. Let's do 1 more. What do you see here? Well done. You have done extremely well. They are designed to be difficult, so please do not worry. Now, how do your eyes feel at the moment? Do you have any pain or discomfort? They're okay? Good. Alright. Well, what I would like you to do now is read this eye chart for me. Okay? So, what's this letter? What letter is it? E. And this one. Perfect. This one. Wonderful. This one. Good. This one. Good. This one. Good. Perfect. And how about this one? Wonderful. Okay, now what colour is this box? Red. And what colour is this one? Green. Very good. Okay, I'm now going to use a light to have a little look into your eyes, okay? This can make you sleepy, alright, so do not worry if you feel that way. Okay, what I would like you to do is look over here at my hand, okay? Look over here. Good, look over here, do not look at the light. Okay, now look over here. Good. Do not look at the light. Okay. Okay, check this eye. This eye. Okay. Could you just look up for me? Look down. Look left. And look right. Okay. Look at the light. 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 Okay. Could you just follow this light for me? Just follow the light. Very good. Keep following the light. Okay. Well, your eyes look fine. You can give them a little blink, blink, blink if you like. I'm not concerned at all. Everything looks absolutely fine. Yeah, you have nothing to worry about. I think if your eyes get a little bit dry or sensitive, try have a nice early night, get lots of sleep. But you can also get some eye drops just to give them a bit of hydration if you're dehydrated. Okay? Alright, well, take care, and I'll see you soon. Bye bye.